For this question, I'm going to teach you what I teach my students through tutoring of how to use USMLE logic to solve step 1 questions. And you'll see that you don't have to have everything necessarily memorized, you just need to understand a couple things when it comes to these questions. So overall, it's a picture of a 50-year-old woman who comes to the physician for 2 weeks, history of pain over the right knee, the anterior right knee that's worse when she gets out of bed. Her range of motion is full, she has no pain on flexion or extension. She has tenderness to palpation over the anteromedial proximal tibia, just below the joint line. Her sensation and strength are intact. Inflammation of which of the following structures is the most likely cause of this patient's symptoms? So this is based off of a NBME question. You may feel overwhelmed looking at the answer options, but let me show you how to make it much simpler. So what you're going to do is just categorize the answer choices into the categories. So A is a ligament, B is talking about a nerve, C and E are talking about joints, and D is talking about a bursa. So first of all, does this question give the picture of nerve pain? And think to yourself, what does nerve pain look like? You would have loss of sensation, maybe changes with tingling, pins and needles kind of feeling, and you don't see that in this question. So we're going to cross off option B. Next, let's tackle the joint answers. So what does joint pain present like? It presents with some change in the range of motion. There would be pain in range of motion because a joint is a space where two bones meet and where things are able to move around. So if they don't have any pain on flexion or extension, it's less likely a joint. So we're going to cross off options C and E. Next, you're left with options A and D, a ligament or a bursa. And ligaments can seem similar to joints, however, ligaments are more like the stretchy connective tissue that connects bone to bone or cartilage, while joint is more of the space or structure where bones meet. So the pain is similar to joint pain, where you'd have pain on range of motion. The other thing too is you don't really have inflammation of ligaments. So that makes A a less likely answer, and you're left with D, bursa. And a bursa is a sac around joints of fluid that can get inflamed in that area, so that's how you can get tenderness to palpation of just the local area, and you can get inflammation because it's within the fluid-filled sac. So even if you didn't know what a ligament pain presents like or joint pain, what we do next then is actually create a table based on the information provided in the NBME explanation to differentiate what does joint pain look like, what does ligament and bursa pain compared to nerve pain look like in this table we built together.